Welcome future nurses. In today's session, we're diving into one of the most challenging areas of the NCLEX, prioritization questions. These questions test not just your knowledge, but your ability to think like a nurse in high-pressure situations. We've created 50 brand new, very difficult prioritization scenarios that will push you to use critical thinking, apply the ABCs, Maslow's hierarchy, safety principles, acute versus chronic, stable versus unstable, and everything you'll need to pass the NCLEX. Remember, the NCLEX isn't just about what you know, it's about how you prioritize care safely and effectively. So grab a notebook, pause when you need to, and challenge yourself with each question. Let's see how many you can get right. Question 1. The nurse is assigned 4 clients during the morning shift. Which client should the nurse assess first? A client with chronic COPD who has an oxygen saturation of 90% on 2L nasal cannula. B. A client 6 hours post-thyroidectomy who reports tingling around the lips. C. A client with type 2 diabetes who has a blood glucose of 250 mg per deciliter. D. A client awaiting discharge teaching for hypertension. Answer, B. Rationale. Tingling around the lips after thyroidectomy suggests hypocalcemia due to parathyroid injury, which can progress to laryngeal spasm and airway compromise. This is life-threatening. Strategy. Apply ABCs plus safety. Airway compromise takes precedence. Question 2. The nurse receives report on 4 clients. Which client should the nurse assess first? A client with heart failure complaining of increasing shortness of breath while lying flat. B. A client with appendicitis reporting pain level August 10th. C. A client with pneumonia receiving antibiotics with temperature of 100.4 degrees Fahrenheit. D. A client post-hip replacement asking for assistance to ambulate. Answer, A. Rationale. Increasing dyspnea when lying flat suggests pulmonary edema from worsening heart failure, which is potentially life-threatening. Strategy. Always prioritize respiratory distress over pain, fever, or mobility. Question 3. Which client should the nurse see first? A client 2 hours post-abdominal surgery with absent bowel sounds. B. A client with a chest tube who has 250 milliliters of bright red drainage in the last hour. C. A client with cellulitis who reports pain at the affected site. D. A client with a migraine waiting for PRN pain medication. Answer, B. Rationale. Chest tube drainage of greater than 200 milliliters per hour of bright red blood indicates hemorrhage priority. Strategy. Prioritize circulation issues/bleeding over routine post-op findings, infection pain, or comfort needs. Question 4. For clients present to the emergency department. Who should the triage nurse see first? A client with asthma who is speaking in broken sentences and has audible wheezing. B. A client with renal colic rating pain as 10 out of 10. C. A client with vomiting and mild dehydration. D. A client with a fractured wrist with obvious deformity. Answer, A. Rationale. The client has respiratory distress and possible impending respiratory failure. Strategy. Apply ABCs, airway always first. Question 5. The nurse is caring for 4 clients. Who is the priority? A client with diabetic ketoacidosis who has Kussmaul respirations. B. A client with pneumonia who is receiving 4 antibiotics. C. A client with sickle cell crisis reporting severe leg pain. D. A client with an ileostomy reporting liquid stool output. Answer, A. Rationale. Kussmaul respirations indicate severe metabolic acidosis, airway and breathing compromise are priority. Strategy. Identify life-threatening complications routine care. Question 6. A nurse has these 4 clients. Who should be seen first? A client 1 hour post-op after laparoscopic cholecystectomy with moderate incisional pain, 6/10. B. A client with a history of stroke who suddenly has new right-sided weakness. C. A client with chronic back pain requesting discharge medication. D. A client receiving chemotherapy complaining of nausea. Answer, B. Rationale. New focal neurologic deficits suggest an acute stroke, time-sensitive, TPA window, imaging. Strategy, prioritize new acute neurological changes, intervene quickly for time-dependent treatments. Question 7. During rounds, which client should the nurse address first? A client with acute pancreatitis with abdominal tenderness. B. A client with a new telemetry alarm showing PVCs in a short run. C. A client 24 hours post-C-section requesting breastfeeding support. D. A client with stage 2 pressure ulcer changing dressing. Answer, B. Rationale, new ventricular ectopy can precede unstable arrhythmias. Immediate assessment needed. Strategy, treat cardiac electrical instability as high priority. Question 8. Which client should the nurse see first? A client with a sodium of 128 milliequivalent/L reporting nausea. B. A client with a PICC line whose dressing is soaked with blood. C. A client with end-stage COPD who requests increased oxygen. D. A post-op client with temperature 100.6 degrees Fahrenheit. Answer, B. Rationale, soaked dressing over central line suggests bleeding or catheter dislodgement, risk of hemorrhage and air embolism. Strategy, prioritize visible active bleeding and invasive device complications. Question 9. Which client is priority for immediate assessment? A client in labor at 38 weeks with late decelerations on fetal monitor. B. A client with UTI complaining of dysuria. C. A client with NSAID diagnosis with mild headache. D. A client with a broken toe requesting pain meds. Answer, A. Rationale, late decelerations indicate uteroplacental insufficiency, fetal distress. Strategy, in maternal/fetal care, fetal distress is immediate priority. Question 10. Which client should the nurse assess first? A client with acute glomerulonephritis with hematuria. B. A client post-MI who reports new chest pain rated 8 out of 10. C. A client with newly diagnosed hypothyroidism needing education. D. A client scheduled for discharge this afternoon. Answer, B. Rationale, new chest pain post-MI suggests reinfarction or ischemia, life-threatening. Strategy, prioritize chest pain in cardiac clients over chronic/educational needs. Question 11. Which patient should the nurse see first? A client 2 hours post-thoracentesis complaining of mild shoulder pain. B. A client on heparin with a platelet drop from 250,000 to 80,000 in 24 hours. C. A client with stable angina requesting PRN nitroglycerin. D. A client with gastroenteritis with poor appetite. Answer, B. Rationale, rapid platelet drop suggests possible heparin-induced thrombocytopenia, HIT, risk of thrombosis, requires immediate action. Strategy, recognize rapid labs changes indicating dangerous complications. Question 12. Which client should be prioritized? A client with new onset confusion and a temperature of 102 degrees Fahrenheit. B. A client with a stage I burn to the forearm. C. A client with stable angina on scheduled meds. D. A client awaiting an elective MRI. Answer, A. Rationale, new confusion with fever may be sepsis or CNS infection, acute and potentially life-threatening. Strategy, prioritize altered mental status plus fever, signs of systemic instability. Question 13. Who should the nurse see first? A psychiatric client who reports auditory hallucinations but is calm. B. A client with an insulin pump who has blood glucose 48 mg per deciliter. C. A client with chronic osteoarthritis requesting PT referral. D. A client post-procedure with scheduled PRN analgesic. Answer, B. Rationale, hypoglycemia, less than 70, and 48 is severe, can progress to seizures/coma, immediate treatment. Strategy, treat acute metabolic derangements immediately. Question 14. Which client is the highest priority? A client with sinusitis receiving oral antibiotics. B. A client with a tracheostomy whose tube cuff pressure is low and leaks audible air. C. A client with elective colonoscopy scheduled tomorrow. D. A client recovering from stroke who needs swallowing evaluation. Answer, B. Rationale: tracheostomy cuff leak risks aspiration and compromised ventilation, urgent intervention to secure airway. Strategy: intervene for airway device malfunction immediately. Question 15. Which client should be seen first? A. A client with hyperkalemia, 6.2 milliequivalent/L, who is asymptomatic. B. A client with a penetrating abdominal wound with stable vitals. C. A client with advanced dementia requesting personal care. D. A client with scheduled dressing change for chronic wound. Answer: A. Rationale: severe hyperkalemia can cause lethal arrhythmias even if currently asymptomatic, requires urgent treatment. Strategy: prioritize abnormal labs with high risk of immediate harm. Question 16. Which client should the nurse assess immediately? A. A client on morphine PCA with respirations 8 per minute. B. A client with controlled hypertension asking about diet. C. A client with stage 4 cancer reporting fatigue. D. A client with a urinary catheter needing routine change. Answer: A. Rationale: respiratory depression, RR less than 10, from opioids is life-threatening, immediate reversal/airway support may be needed. Strategy: airway/ventilation deficits come first. Question 17. Which client should be prioritized first? A. A client with DVT receiving heparin who has sudden shortness of breath and pleuritic chest pain. B. A client with chronic anemia requiring iron teaching. C. A client with eczema requesting steroid cream. D. A client with scheduled wound VAC dressing change. Answer: A. Rationale: sudden SOB and pleuritic pain in DVT patients suggests pulmonary embolism, life-threatening emergency. Strategy: symptoms of embolism/PE require emergent assessment. Question 18. Which patient requires immediate nursing attention? A. A client 3 days post-CVA with stable vitals. B. A client with a newly inserted Foley whose urine is bright red and clotted. C. A postoperative client with stable hemoglobin. D. A client with ADHD requesting medication refill. Answer: B. Rationale: bright red clotted urine signals active bleeding from urinary tract, risk of obstruction/hemorrhage. Strategy: act on visible active bleeding in urinary output. Question 19. Which client should the nurse evaluate first? A. A client on continuous heparin infusion with new unilateral limb swelling. B. A client with asthma with minimal wheeze controlled on inhaler. C. A client with chronic renal disease needing medication reconciliation. D. A client post-tonsillectomy with mild throat soreness. Answer: A. Rationale: limb swelling may indicate progression of DVT despite heparin or bleeding, needs urgent evaluation. Strategy: prioritize signs of thrombotic or bleeding complications in anticoagulated patients. Question 20. Which client is priority to see first? A. A client with severe hyperglycemia, glucose 480 mg per deciliter, with fruity breath and Kussmaul respirations. B. A client with newly started SSRI feeling mild nausea. C. A client with chronic hypertension wanting smoking cessation advice. D. A client scheduled for discharge teaching. Answer: A. Rationale: DKA signs, very high glucose, fruity breath, Kussmaul respirations, require immediate management. Strategy: recognize metabolic acidosis/DKA as urgent. Question 21. Which client should be seen first? A. A client who had a seizure 5 minutes ago and is postictal but breathing. B. A client with a small seroma at surgical site. C. A client with seasonal allergies requesting antihistamine. D. A client with chronic venous insufficiency needing compression stockings. Answer: A. Rationale: postictal state can progress to airway compromise, need to monitor airway, breathing, and prevent aspiration. Strategy: after seizure, immediate airway and neurological assessment is priority. Question 22. Which patient requires urgent assessment? A. A postpartum client with fundus displaced to the right and soaking peripad. B. A client with mild hypokalemia, 3.3 milliequivalent/L, with no ECG changes. C. A client with chronic migraines coming for routine visit. D. A client with mild allergic dermatitis. Answer, A. Rationale: fundus displaced to the right suggests full bladder causing uterine atony and postpartum hemorrhage risk, bleeding control needed. Strategy: in postpartum, uterine displacement plus bleeding is urgent. Question 23. Who should the nurse attend to first? A. A client with a leaking aortic graft who is hypotensive and tachycardic. B. A client with varicose veins scheduled for outpatient procedure. C. A stable renal transplant client for medication teaching. D. A client needing routine morning glucose check. Answer, A. Rationale: hypotension/tachycardia with graft leak indicates hemorrhagic shock, immediate resuscitation. Strategy: hemodynamic instability is highest priority. Question 24. Which client is the highest priority? A. A client with COPD on 2LO2 whose PaO2 is 58 mm of mercury. B. A client with acute diverticulitis with mild abdominal pain. C. A client with chronic insomnia seeking sleep hygiene advice. D. A client awaiting routine blood draw. Answer, A. Rationale: PaO2 less than 60 indicates inadequate oxygenation, respiratory compromise requiring immediate intervention. Strategy: monitor ABGs and prioritize oxygenation issues. Question 25. Which client should be seen first? A. A client on vancomycin who develops flushing, rash, and hypotension during infusion. B. A client with stable angina on scheduled meds. C. A client with newly diagnosed hypothyroidism for education. D. A client needing routine dressing change. Answer, A. Rationale: red man syndrome/anaphylactoid reaction during vancomycin infusion can progress to hypotension and airway issues, stop infusion and intervene. Strategy: treat infusion reactions immediately. Question 26. Which client requires immediate intervention? A. A client with a wet, boggy abdomen and fever 24 hours after cesarean section. B. A client with chronic GERD seeking diet advice. C. A client with eczema asking about triggers. D. A client with scheduled PT for total knee replacement. Answer, A. Rationale: boggy, tender abdomen with fever post-C-section suggests endometritis or hemorrhage/infection, needs prompt assessment and antibiotics/management. Strategy: post-op infection/bleeding signs are urgent. Question 27. Which client should the nurse evaluate first? A. A client with symptomatic bradycardia, HR38, complaining of dizziness. B. A client with stable atrial fibrillation on rate control meds. C. A client with chronic constipation needing laxative education. D. A client with scheduled discharge today. Answer, A. Rationale: bradycardia with symptoms suggests compromised perfusion, immediate cardiac intervention may be needed. Strategy: prioritize hemodynamic instability. Question 28. Which client is the highest priority? A. A client with severe burns covering 40% TBSA complaining of increasing pain and anxiety. B. A client with a small pressure ulcer requiring dressing. C. A client in clinic for routine immunization. D. A client with seasonal allergies asking for OTC options. Answer, A. Rationale: large TBSA burns pose high risk for shock, airway compromise, and infection, needs urgent ongoing assessment. Strategy: treat major burns as high acuity. Question 29. Which client should the nurse see first? A. A client on chemotherapy with neutrophils 400/L and fever 100.8 degrees Fahrenheit. B. A client with chronic venous stasis needing shoe recommendations. C. A client with mild constipation. D. A client requesting discharge instructions. Answer, A. Rationale: febrile neutropenia is medical emergency due to high infection risk, needs immediate workup and 4 antibiotics. Strategy: prioritize immune compromise plus fever. Question 30. Which patient requires immediate attention? A. A client with new onset shortness of breath and stridor after extubation. B. A client with scheduled wound dressing change. C. A client with chronic hypertension refilling meds. D. A client with mild insomnia. Answer, A. Rationale: stridor indicates upper airway obstruction, emergency airway management needed. Strategy: always prioritize airway sounds indicating obstruction. Question 31. Which client should be seen first? A. A client with acute stroke receiving alteplase who develops sudden bleeding from foresight. B. A client with a scheduled echocardiogram. C. A client with dyslipidemia needing diet instructions. D. A client requesting change of room. Answer, A. Rationale: bleeding during thrombolytic therapy is life-threatening, stop infusion and manage bleeding. Strategy: intervene for bleeding on thrombolytics immediately. Question 32. Which client is the highest priority? A. A diabetic client who missed insulin and is now vomiting and weak. B. A client with chronic migraine awaiting neurology referral. C. A client needing routine vaccines. D. A client with intermittent edema. Answer, A. Rationale: missed insulin with vomiting and weakness may indicate DKA/hyperosmolar state, acute metabolic emergency. Strategy: identify missed insulin plus systemic symptoms as urgent. Question 33. Which client should the nurse address first? A. A client 30 minutes post-thyroidectomy with a tight feeling in the neck and stridor. B. A client with mild anemia scheduled for discharge. C. A client with chronic low back pain. D. A client waiting for routine labs. Answer, A. Rationale: stridor and neck tightness after thyroidectomy indicate airway compromise from hematoma, immediate removal and emergency airway needed. Strategy: recognize postoperative neck swelling/stridor as immediate airway emergency. Question 34. Which client requires immediate assessment? A. A client with suspected sepsis who now has MAP 55 mm of mercury and cool extremities. B. A client with seasonal allergies asking about nasal spray. C. A client with mild osteoarthritis needs PT referral. D. A client with an outpatient follow-up appointment. Answer, A. Rationale: low MAP and poor perfusion are signs of septic shock, urgent resuscitation. Strategy: treat hemodynamic compromise rapidly. Question 35. Which patient should the nurse see first? A. A client receiving blood transfusion who reports chills and back pain 15 minutes after starting. B. A client with a well-controlled seizure disorder. C. A client with chronic dermatitis requesting cream. D. A client with scheduled physical therapy. Answer, A. Rationale: chills and back pain during transfusion suggest acute hemolytic transfusion reaction, stop transfusion and intervene immediately. Strategy: recognize transfusion reactions and act immediately. Question 36. Which client should be prioritized? A. A client on beta blocker with sudden wheezing and respiratory distress. B. A client with stable hypothyroidism coming for routine med refill. C. A client with planned discharge tomorrow. D. A client needing routine wound dressing. Answer, A. Rationale: bronchospasm from beta blocker in bronchospastic disease can be life-threatening, stop med and treat airway. Strategy: address medication-induced respiratory compromise immediately. Question 37. Which client requires immediate attention? A. A client with ascending paralysis and recent history of gastroenteritis. B. A client with chronic eczema needing topical steroid refill. C. A client with scheduled outpatient imaging. D. A client with mild dehydration. Answer, A. Rationale: ascending paralysis after GI illness suggests Guillain-Barré syndrome, risk of respiratory muscle involvement, monitor respiratory function. Strategy: monitor neuromuscular respiratory compromise and act early. Question 38. Which client should be seen first? A. A client with sudden vision loss in one eye this morning. B. A client with stable COPD for routine education. C. A client with mild ankle sprain waiting for X-ray. D. A client with planned colonoscopy prep. Answer, A. Rationale: sudden monocular vision loss can be retinal artery occlusion, time-sensitive for vision salvage. Strategy: prioritize acute sensory loss for time-dependent interventions. Question 39. Which client requires immediate assessment? A client on MAOI who ate foods high in tyramine and now has severe headache and BP 210/120. B. A client with fatigue from mild anemia. C. A client scheduled for routine EKG. D. A client needing routine dressing change. Answer: A. Rationale: hypertensive crisis from MAOI tyramine interaction is life-threatening, rapid BP control required. Strategy: treat acute severe hypertension with end organ risk immediately. Question 40. Which client should the nurse evaluate first? A. A client with a post-op pulmonary embolism on heparin who now has hemoptysis. B. A client with stable gastroesophageal reflux. C. A client with scheduled dietary counseling. D. A client with minor laceration needing sutures tomorrow. Answer: A. Rationale: hemoptysis in anticoagulated PE patients suggests major bleeding, high priority. Strategy: balance thrombosis versus bleeding, active bleeding takes precedence. Question 41. Which client is priority to see first? A. A client with severe preeclampsia, BP 170/110, and headache. B. A client with mild varicella exposure and no symptoms. C. A client awaiting routine prenatal education. D. A client needing a routine urine collection. Answer: A. Rationale: severe preeclampsia with severe range BP and headache indicates risk for eclampsia/stroke, immediate management required. Strategy: in pregnancy, severe hypertension is urgent. Question 42. Which client should the nurse assess first? A. A client with acute onset jaw pain, diaphoresis, and nausea. B. A client with chronic insomnia seeking behavioral therapy. C. A client with mild acne. D. A client needing routine immunizations. Answer: A. Rationale: jaw pain with diaphoresis and nausea suggests acute MI, immediate cardiac evaluation. Strategy: treat possible MI as immediate priority. Question 43. Which client requires immediate action? A. A client with sudden hypotension and neck vein distension after central line placement. B. A client with stable COPD scheduled for routine pulmonary function tests. C. A client with mild pruritus. D. A client needing routine lab follow-up. Answer: A. Rationale: hypotension plus JVD after central line suggests tension pneumothorax or air embolism, immediate emergency treatment. Strategy: consider procedural complications as emergencies. Question 44. Which patient should be seen first? A. A client with uncontrolled bleeding from epistaxis who becomes hypotensive. B. A client with mild GERD symptoms. C. A client with scheduled nutritional counseling. D. A client with routine medication reconciliation. Answer: A. Rationale: hypotension from bleeding indicates hemorrhagic shock, immediate stabilization required. Strategy: treat active bleeding with hemodynamic instability first. Question 45. Which client should the nurse prioritize? A. A client with suspected meningitis who has sudden neck stiffness and high fever. B. A client with a chronic foot ulcer scheduled for dressing. C. A client with seasonal allergies. D. A client with routine checkup. Answer: A. Rationale: meningitis is rapidly progressive and requires immediate isolation, lumbar puncture, and antibiotics. Strategy: recognize potential CNS infections as urgent. Question 46. Which client is the highest priority? A. A client with a transfusion-associated anaphylactic reaction, wheezing, hypotension. B. A client with chronic back pain requesting analgesia. C. A client with routine blood sugar checks. D. A client scheduled for elective MRI. Answer: A. Rationale: anaphylaxis is immediately life-threatening, epinephrine and airway support needed. Strategy: treat anaphylaxis before comfort/routine tasks. Question 47. Which client should be seen first? A. A client with new-onset atrial fibrillation with rapid ventricular rate and hypotension. B. A client with stable atrial fibrillation controlled on meds. C. A client with mild dermatitis. D. A client awaiting discharge instructions. Answer: A. Rationale: RVR with hypotension indicates unstable arrhythmia, immediate cardioversion or rapid stabilization required. Strategy: unstable cardiac rhythms are high priority. Question 48. Which patient requires immediate attention? A. A client with severe electrolyte disturbances, NAL 120, confused, seizure activity. B. A client needing routine blood pressure check. C. A client with mild seasonal allergy. D. A client with scheduled physical therapy. Answer: A. Rationale: hyponatremia with seizures indicates acute cerebral dysfunction, urgent correction and monitoring required. Strategy: address neurological symptoms from electrolytes immediately. Question 49. Which client should the nurse see first? A. A client with a GCS score dropping from 15 to 11 over the past hour. B. A client with stable chronic anemia. C. A client requesting routine dietary counseling. D. A client with scheduled dressing change. Answer: A. Rationale: dropping GCS indicates worsening neurological status, potential intracranial process requiring immediate evaluation. Strategy: prioritize declining neurologic status. Question 50. Which client should the nurse treat first? A. A client with sudden onset severe abdominal pain and rigid board-like abdomen. B. A client with chronic hypertension needing BP meds. C. A client with planned discharge in afternoon. D. A client with mild allergic reaction to insect bite. Answer: A. Rationale: rigid, board-like abdomen indicates peritonitis/possible bowel perforation, surgical emergency. Strategy: acute abdomen with peritonitis signs demands immediate action. Great job working through these 50 difficult NCLEX prioritization questions. If you made it this far, you're already sharpening the most important nursing skill, critical decision-making under pressure. Remember, on the NCLEX and in real nursing practice, the right answer is always about who is most at risk, who is least stable, and what intervention saves life and safety first. If this helped you, don't forget to like, share, and subscribe for more NCLEX practice made simple. Drop your score in the comments, let's see how many you got correct. And as always, keep practicing, keep learning, and keep believing in yourself. You've got this, and the NCLEX is yours to conquer.